What are the risks of blood transfusions for kidney disease anemia? Imagine needing a quick boost to your blood count, but knowing that a transfusion might come with some hidden risks. For people with chronic kidney disease, or CKD, managing anemia can be tricky. Sometimes doctors turn to blood transfusions to help, especially when other treatments like erythropoiesis-stimulating agents are not enough. But it's important to understand that transfusions are not without potential problems. One major concern is iron overload. Every transfusion adds extra iron to your body. Since your body cannot naturally get rid of excess iron, repeated transfusions can cause iron to build up. Too much iron can damage vital organs like your liver and heart, which is especially concerning for those with CKD who already have a higher risk of organ issues. Transfusion reactions are another risk. Some reactions are mild, like itching or a rash, but others can be more serious. For example, febrile reactions cause fever, and hemolytic reactions happen when your immune system attacks the transfused red blood cells. These reactions can be dangerous and requiring immediate medical attention. Immune sensitization, or alloimmunization, is a process where your immune system develops antibodies against foreign proteins on donor red blood cells. For CKD patients, this can make future blood matching more difficult and can interfere with kidney transplants. If you need a transplant later, having these antibodies can increase the chance of rejection and make finding a compatible organ harder. Although modern screening has greatly reduced the risk, there is still a small chance of transmitting infections through transfusions. Diseases like hepatitis B, hepatitis C, and HIV are rare but possible risks, especially if blood is not properly tested. Transfusion-related acute lung injury is a rare but serious complication. It causes sudden lung inflammation and fluid buildup, leading to difficulty breathing. This can happen shortly after a transfusion and requires urgent care. Fluid overload is another concern, especially for CKD patients. Transfusions add volume to your blood, which can overwhelm your heart and lungs. This can lead to heart failure or worsen existing cardiovascular problems, which are common in kidney disease. Research shows that patients with CKD who need frequent transfusions might have a higher risk of cardiovascular events and even increased mortality. This is partly because rapid increases in hemoglobin levels from transfusions can put extra strain on your heart. Because of these risks, doctors usually prefer to manage anemia with medications like erythropoiesis-stimulating agents and iron supplements. These treatments aim to keep hemoglobin levels between 10 and 12 grams per deciliter, reducing the need for transfusions. When transfusions are necessary, they are typically reserved for emergencies like severe bleeding or when other options are not suitable. In summary, blood transfusions can provide quick relief from anemia symptoms, but they come with significant risks. These include iron overload, immune system sensitization, reactions, infection transmission, lung injury, and cardiovascular issues. It's essential to discuss all treatment options with your healthcare team to find the safest approach for your individual situation. Remember, managing anemia in CKD is a careful balance, and your medical team is there to help you navigate it safely.